I'm Eric Christian Olsen. I'm here representing the Environmental Media Association. We want to give our viewers an opportunity to hear directly from the scientists. We talked a little bit about this last time, when sometimes there's a vacuum in the roles of leadership that are doing fringe witchery and giving us ideas about ingesting chemicals of Lysol into our lungs. We like to go back to the science. We had a wonderful conversation last week with Dr. Aaron Bernstein. And looking for someone to talk to this week, we found Christopher Golden, and Dr. Bernstein actually wrote me an email. I don't know, Chris, if he knows this or not. I'm going to get the quote right. Chris is to public health what Indiana Jones is to archaeology, which is the greatest way to introduce anybody. Chris Golden is assistant professor of nutrition and planetary health at Harvard T.H School of Public Health. He's an ecologist, epidemiologist, interested in the interface of ecosystem service provisioning and human health, specifically in the context of global trends in biodiversity loss and ecosystem transformation, which is also a wonderful intro. If you were to explain to my 7-year-old Wyatt what exactly that is without using those words, what is it that you do?
Sure. So I tend to frame kind of the definition of planetary health as really looking at the human health impacts of environmental change. And so whether you're thinking about climate change, biodiversity loss, kind of the increasing proliferation of cities driven by urbanization, the destruction of forests for fuel or firewood, all of those environmental changes will have some sort of downstream effect on human health. And so really what I'm trying to do is to apply kind of quantitative and empirically rich methods to understand these kind of holistic changes in the transformation of the planet and how they then trickle down to have impacts on human health.
Great. That was it. That was wonderful. He also wanted, Dr. Aaron Bernstein wanted me to ask you about your commute. He goes to the hospital there in Boston. I travel to Paramount Studios, which is 35 minutes, and you're doing most of your work where?
So most of my work is in Madagascar. I've been working there since 1999, but also have a new research project that is started up in Kiribati in the South Pacific.
Wow. But that's 21 years then in Madagascar. What have you been learning so far? And that math, because you're like 32, so you started there when you were 8.
37, and started when I was 16.
And what have you been up to?
With a researcher from Duke University and told him that I would do anything like clean up the campsite and carry heavy things, and just told him I would do whatever to get out there. I'd always just been fascinated with the place. Specifically
with Madagascar? I mean, what drew you to Madagascar specifically?
You know, when I was 9 years old, I did an animal report, and they asked us to choose any animal, and I was flipping through an encyclopedia of animals and came across the page for the ring-tailed lemur, and completely fell in love with the ring-tailed lemur. And ever since then, I just kind of read everything I could get my hands on about Madagascar, totally fell in love with the biodiversity there. When I first started going there, my work was very much angled at conservation, understanding kind of the work that I could do to enable better conservation systems to preserve biodiversity. And in returning there year after year and in living with people in local communities, I realized that there was such a heavy dependence of the local people on biodiversity and the functioning of forests and other ecosystems. And that if we focused exclusively on conservation without taking people's needs into consideration, right, there would never be kind of this optimization space where both things could be balanced. And so I kind of shifted a lot of my work. As an undergrad, I did a special concentration at Harvard where I mixed medical anthropology, ecology, and development studies. And then for my grad work, I did an MPH in epidemiology and public health and a PhD in ecology and environmental science. And so I'd always really been wanting to understand this kind of dialectical relationship between the environment and human health and how they speak to each other and how we can create compatible systems between the two.
That's so amazing. And I think I want to go back to the very first beat that you said, which is that that's a 9-year-old looking through a book and seeing a lemur and being like, I want to go and save the lemurs. Totally. And it turned into this, which I think is an important lesson for all of us when we talk about, I mean, I'm a parent, so I'm obsessed with like, how do you install the values that we hold dear into children to get them passionate. And yours started off with an emotional connection to a creature, to a lemur. And how do we save that lemur? And then in doing so and going a deep dive, got into the complexity of, you know, how that whole system works with the human element and the human interface, which is actually a good time to transition into it. You're doing connections between water and land and wildlife consumption and health. The question is this simple. Can you tell us what you've learned? And they have written down, is eating wildlife good or bad for us? Which I feel like is a skit from like good, bad.
Sure.
And I know it's much more complex than that. So walk us through it.
Way more complex than that. And so I can't give you the kind of thumbs up, thumbs down response.
We don't want that. That's the wrong kind of science.
So the work that I'm doing is really aimed, let me focus on kind of Madagascar to start.
Great.
The work that I'm doing there is really aimed at understanding how biodiversity changes and ecosystem declines will influence food security and human nutrition. So when I talk about planetary health broadly, I talked about all of these kind of changing environmental courses at planetary scales that can, of course, have different impacts on human health across a range of different types of health. So there's nutrition, there's mental health, there's infectious disease like COVID, there is non-communicable diseases, there is civil strife and human displacement. There's all different kind of domains of health. The one that I tend to focus on the most is nutrition. At a global scale, more than 2 billion people are affected by micronutrient deficiencies. And so to me, this massive burden of disease is something so critical to understand and seems like something where we should really be able to wrap our heads around it. Why can't we find ways of developing sustainable food systems that provide critical nutrients to those who need it? And especially it highlights these issues of kind of environmental justice and social justice, where we have such abundance on one side and such inadequacies on the other. Why can't we find a way to develop these systems to target the ones that are most at need? And so that's just kind of an entry point into my moral framework for why I work on these issues. For me, there's really no two more important issues than conservation and the preservation of our planet and the support of human well-being, human health, and kind of supporting the infrastructure that underlies that. And really the food system sits right there. It's really at this nexus between environmental resource demands and how we feed people. And so the work that I'm doing in Madagascar is looking at one particular type of system. In the US, we are clearly going to grocery stores and purchasing our food for the most part, or if you're thinking about right now, we're getting it delivered by Instacart or some kind of mechanism, but it's a very kind of indirect approach to accessing food. Where I work in Madagascar, I've studied the diet of local people for a very long time, and it's an incredibly autarkic production system. And what that means is that almost everything is either produced locally or harvested from the forest. And so you are talking about very small scale, localized agriculture. You're talking about going into the forest to collect medicinal plants and wild fruit and wild vegetables and lemurs and bats and everything that is going to compose their kind of local diet. When I actually quantified what people were eating, there were more than 300 different food items that were consumed in their diet over a given year. And only around 5 or 6 of those were purchased in a store. So it's the salt, flour, sugar, oil, and then everything else is just produced locally or harvested in the wild. And so when you think about that type of food system, it is so heavily dependent on the functioning of ecosystems. And there's a very kind of intuitive connection with local people, knowing that if they are not properly managing and being stewards of their local environment, there will be kind of immediate and direct repercussions on their own well-being and on their own food systems. And it's so hard for us to see in the kind of global north that what we are doing to the planet at global scales is having these same types of negative impacts, but all of the externalities are so far displaced that we're not able to actually see that immediate repercussion in a way that becomes intuitive to us in kind of connection and in harmony with our environment.
Great. And that's the perfect time to have this conversation, because it was so theoretical for, what did you call it? The North? what did you call the rest of us? The global north. So we are the global north, right? Because we don't.
It's the friendly way of saying the developed world, so that you're not calling someone kind of more or less developed.
Right. Okay. Great. So the global north, and that's why this conversation is so fantastic to have now during COVID, because we are seeing a direct effect of how we're treating the planet. Can you back up? I got so many questions. I'm already off the page where they had all the questions written down. Can you back up to, so if you have people living in Madagascar and the primary source of animal proteins are bushmeat, right? And I read all those studies, you've got 10% of them eating bats.
Yeah.
The primary source of from Tenerax, is that right?
Yeah. Tenerax.
And we look at that as a necessity, right? If most of their meat is coming from bushmeat, or they're looking at the fisheries that have been depleted to a point where they're having to go further and further out. When we say conservation, we go, all right, we have to stop consuming bushmeat in this way. But when you talk about the moral framing of what it is that you do, you can't just conserve wildlife when you have people that are chronically malnutritioned, right? You have stunted growth. It was something like 70% of these kids were malnutritioned. Is that right?
Exactly. So you can't think about these systems in isolation. And so when we talk about the food system, the whole point of me going down that tangent of saying all of the kind of components of their food system are produced locally is that when the environment is affected, so if people are hunting too much, they're actually self-depleting their own nutritional resource.
Yes.
People are over-harvesting fish and putting out kind of purse seines or other nets that's going to kind of destroy the local environment. That is going to then minimize their future ability to catch more fish in a sustainable way. And so all of these kind of environmental processes that are happening and unfolding around them will have these kind of negative impacts on the availability of future food and future nutrition. And so that became kind of the object of the study. In one of my kind of better known studies, we showed that a removal of bushmeat from the diet would lead to a roughly 30% increase in the incidence of anemia. And so it really puts together these kind of, it puts conservation and human health and well-being at odds for a moment and really says, what happens if we lose access? And that's just one mechanism while they lose access. They could kind of unsustainably hunt these species without any conservation intervention, and they would still lose access. But conservation and the implementation of conservation policy to remove people's access from bushmeat would also lead to a similar result.
Right.
And so it then kind of really opened my mind. I think that the way that I've described this to many of my colleagues in terms of what I do is listening to local people, hearing their stories, and then developing study designs to kind of put data and to put research to kind of amplify their voices of what they already know. So I'm not discovering anything or uncovering anything new that local people have not known for generations, if not millennia. What I'm trying to do is to harness my experience of being embedded within these local cultures to amplify their voices about what they already know, and to develop kind of empirical models to showcase kind of this indigenous traditional knowledge. And so what I'm really trying to do with my work is to really explain how dependent people are on healthy, functioning ecosystems.
Right.
And at the end of the day, their needs are actually completely aligned with the needs of conservation. Both of them ultimately want as an objective healthy, functioning, biodiverse ecosystems. And yet they have very different things at stake. And so on the one hand, the conservation organizations have their objective of maintaining biodiversity at stake, but they don't have that same localized connection.
Right.
And local people have something very different at stake. They have the need to provide food for their family.
Families.
It's like, will they meet their kind of ends meet at the end of the day to provide food on the table for people that desperately need it? And so in recognizing that, you kind of have to put those two things together and say, well, how can we develop systems that will simultaneously benefit from the way that we manage this environmental system?
Great. So and when you talk about the global north, you see videos being spread around, the internet, and you look at wet markets, a place, the human and animal interfaces, and it's so simple, right? We just stopped doing it. People stop eating bats. They stop eating bushmeat. It's a very simple discussion.
Yeah.
When you go into this and you talk about, well, the other side of that is the fact that you have people living here and they have to feed their children, and you just said it's a 30% rise in anemia if they don't have bushmeat. So what are those complex solutions?
Sure. I'm really glad you brought this up because there are two different dimensions of bushmeat. One is kind of the subsistence hunting of wildlife for food. And then the other is the kind of more luxury value of bushmeat that's either used to supply urban markets or even in kind of international trade for a medicinal market.
Right. Rhino tusks in China.
Exactly. And so or pangolin meat or shark fin or whatever it might be. Right. And so on the one end of the spectrum, kind of again, how my moral framework operates within this research space, thinking about the ways in which all of the kind of luxury end of bushmeat is used, I think should be completely banned, regulated, and managed in such a way that those markets no longer exist. Great.
And that's done through the government, from a government standpoint?
From government and intergovernmental bodies. So something like CITES, which is kind of a way of managing all endangered species products that are traded. It's also done, quite frankly, very successfully on a kind of social peer network pressuring side of things where you can market the fact that this is really not something that should be done. And so creating stigma around some of these products has been an important way of doing this, particularly in places like China.
Right.
The trickier part of this, and where it becomes more of a kind of mental exercise, is when you have the subsistence needs at ends with kind of conservation desires. And so what you need to do there is develop some sort of conservation and development framework where you implement public health interventions, you implement development initiatives, you implement kind of food systems programming to alleviate pressure on environmental systems while at the same time supporting the nutritional needs of the population. And so the way that we've done that locally in Madagascar was we did a lot of research into the food system. And this was not just kind of nutrient analysis and kind of public health research. I did research looking at the kind of spiritual cosmology of the local Betsimisaraka ethnic linguistic group, to understand how the different types of food products resonated with their cultural systems. We did economics research to look at the differences between domesticated meat versus wild meats. We did gender analysis to look at how different types of assets were managed within the household. And all of our different types of research all circled back to the same solution, which was that we should really focus on poultry husbandry. And so this was for a variety of different reasons. When I did a taste preference test, people kind of above all other types of wild foods rank chicken as their number one taste preference. So not everything tastes like chicken. Really, this was kind of number one. When you look at the economic dimensions of the food system there, domesticated meats are far more expensive than wild meats. And so this again goes to that this is a food of poverty and of need, and yet they're more preferred. And so if there was a way to increase productivity and reduce the price, you could then kind of naturally wean people away from those wild food sources and move them into sustainably produced domesticated alternatives. And lastly, women tend to be the asset holders for poultry. And so by increasing the productivity of village poultry, you are also directly improving the well-being of the household, because we all know that when you increase the well-being of the female head of household, there's going to be additional benefits that are accrued to education, health, nutrition, all of those good things that mothers really care about. And what development economists will show that when you have a kind of male gendered asset, a lot of that extra money will flow into things like alcohol and music and things that are not necessarily supporting the household at large.
That's how it is in my house. I get money, I blow it on Stevie Nicks concerts and booze, and my wife puts it into education and chickens.
Yeah.
That we should say here that we'll provide a link. You have a beautiful 7-minute, you have two 7-minute shorts that you produced yourself and beautifully shot about chicken, poultry husbandry, and also the fisheries.
Sure.
Which I think are fantastic. And you guys are actually the people that vaccinated these chickens for Newcastle disease.
Exactly. So we actually, working with the local Malagasy government and a small business in Madagascar, co-developed a vaccine for Newcastle disease. And so Newcastle disease is a kind of viral pathogen that affects poultry in Madagascar. It affects poultry even in California. There was a recent outbreak of Newcastle disease. So this is something that affects many different parts of the world. And it is a very virulent disease that could wipe out kind of 60 to 90% of chicken flocks seasonally. And so this is a major impact on people's local livelihoods. And so what we did was kind of co-develop this vaccine. It's a unique vaccine there in Madagascar because the previous vaccines were only administered by a syringe, and they also were not a live vaccine. And so the syringe means that you could only have a skilled professional implant it.
Right.
And the non-live vaccine meant that there was no herd immunity developed within the poultry systems. And so the one that we developed is actually an eyedropper, and you kind of use the eyedropper to just drop a droplet of eye into the chick or chicken's eye. And then it is a live vaccine, and it's also thermostable. And so in a place like Madagascar that's very far from electricity and refrigeration, this was really transformational in this area in terms of getting vaccination for local livestock. And so what we're hoping to do is to really have productive village poultry systems that then offsets the demand for bushmeat in the forests.
Which is the perfect transition to on a rabbit hole I went down with the bubonic plague, which is that when fleas that got into the rat systems, and the bubonic plague kills 80% of rats, but it doesn't kill any of the tenoraks.
Yes.
Right? But then people were eating the tenoraks, and then you had 124 deaths and 1,200 cases. Can you walk us through? Because that, I think, that's a great springboard to get into COVID.
Sure. So really interestingly, Madagascar is one of only a handful of countries that still has endemic bubonic plague. So most of us have heard of the plague from the Middle Ages, where it's kind of massive epidemics, but it's been eradicated from most countries on Earth. I believe that Nigeria, India, and Madagascar are the only 3 countries left that have it. Most of the reasons why, and I hope I'm not speaking too politically, but I think that most of the reasons why it has not been eradicated from Nigeria and India tend to be more along the lines of certain segments of population not wanting to vaccinate or fully kind of put in mechanisms to minimize the spread of bubonic plague. Whereas in Madagascar, the reason is quite different, where there are still a very interesting kind of constellation of local reservoirs for Yersinia pestis, which is the disease-causing agent of bubonic plague.
Right.
And so not only does it spread within rodent populations in Madagascar, it also spreads within tenrec populations. And so tenrecs are, I always describe them to my students and find that I'm being kind of rapidly aged out of my jokes, but they look like smaller versions of rodents of unusually large size from The Princess Bride.
Princess Diaries reference, I'm with you. I'm still with you. I got you.
So I'm rapidly getting aged out of that joke, but that is kind of what they look like. They look like kind of miniature aggressive hedgehogs. And there are, I don't know the number off the top of my head, but there are tens of different species of tenrecs in Madagascar that go everything from shrew tenrecs and aquatic tenrecs to the more common ones like common tenrec and hedgehog tenrecs. And what we find in Madagascar is that the Yersinia pestis is actually doing something quite unique within the species systems, where they are able to survive without getting killed off within their immune systems. And so within rodent populations, there's only about a 20% survivorship once Yersinia pestis kind of rifles through a rodent population. With the hedgehog tenrec specifically, there is kind of most recent research, and forgive me if this is not perfectly accurate, but roughly 100% immunity to Yersinia pestis, allowing for it to maintain itself within these wildlife reservoirs and consistently spill over both to rodent populations and perhaps directly via fleas to human populations.
So that's a perfect example of if we, now you're talking about poultry husbandry. If we can replace that with poultry, there's a better chance that we won't have that human to animal interface where we've brought ourselves bubonic plague.
Absolutely. And people will often bring up, well, domesticated animals aren't completely immune from these types of issues as well. We have SARS, you have bird flu, you have a bunch of different things that could be based within poultry systems, that could be based within kind of cattle, pork, whatever. And my kind of main response to that is, if I was a betting man, I would kind of bet on the domesticated livestock being a less active and competent vector for these types of disease than a population that's relying on primates, bats, and a variety of other types of bushmeat, which we know are very competent hosts for human relevant diseases.
Great. Well, you're already talking about solutions. I do have a question though, because we're hearing, I think we just crossed 1 million cases of COVID here in the States, and we're hearing so much about what those numbers look like in the global north. What does it look like sub-Sahara? Like, what does it look like in Madagascar?
The numbers are still a really tricky thing to look at right now, because there are issues with tests where we don't know exactly the precision of certain types of tests. And then also there is the ability to even access tests. So right now, the government of Madagascar is saying that there are roughly 122 cases, that there have been 0 deaths and 40 recovered individuals. Without, again, getting too political, the president of Madagascar has also announced that Madagascar has discovered a cure for coronavirus that is artemisinin based. And he has released all of the students in the country to return to school and drink a half cup of this potion before returning each day. And so I am afraid that this has not been properly vetted, and would definitely suggest that this gets vetted more. It's not that I don't believe in its possibility that there could be something discovered there. There's a great variety of ethnobotanical medicines that I've researched for a very long time in Madagascar, and definitely believe in traditional medicine as a whole. What I will say is that it seems a little too soon to rely on that to be the guaranteed way of preserving the population's health at large.
Yeah, and to be trying it out on the kids is worrisome, doesn't do justice to what that feels like.
No.
Wow, I did not know that. Let me pivot. What changes can we make either in the developed or developing world to better increase the food security around the world and protects better world health?
Yeah, let me just mention one other thing before we jump.
That totally blew my mind. I was just like, how does one reconcile with being a parent and being like, oh, you're gonna drink this potion and go back to school? It totally rocks me.
Is that the need for disease surveillance and the need for unified, nationalized, and even perhaps internationalized health systems for monitoring and detecting this type of disease is so critically important. It really inhibits public health professionals from acting and implementing any type of interventions, even if they're going to be adjusted later down the line, without having a solid knowledge base to act on. Right. So one of the things we're trying to do in Madagascar is really to generate a digitalized electronic platform where we are going to include all of the health data for around 25 different illnesses that are experienced around Madagascar. And of course, coronavirus could be added to that. We will then integrate that with climate data, agricultural data, environmental data and data layers, ocean data layers, to see if we can use kind of machine learning and AI approaches to disentangle some of the root causes of disease emergence. And so can we look and understand the rise of malnutrition in certain parts of Madagascar based on temperature and soil moisture drivers and patterns of deforestation? Can we understand the rise of diarrheal disease in certain areas based on looking at satellite images of harmful algal blooms and upstream deforestation that then muddies the waters and increases bacterial carriage? And so for me, unifying these information systems and having them be nationalized is so critically important to triaging care and to triaging interventions. And so it's something that we're trying to develop called climate smart public health in Madagascar, and working with the government there. And I see that as kind of a really hopeful intervention in Madagascar specifically. And I even wish we had systems like that here in the US. I mean, as all of this was evolving, you can imagine how much easier this would have been had there been some sort of unified health information system here.
Right. Is there any country that's doing this kind of at a national level successfully that you can use as a prototype?
So for climate smart public health, not really. This is something that we co-developed. I was one of the lead consultants with the World Bank, and Madagascar was the first country we chose, largely because of my long standing there.
Wow.
And so it's really exciting that we've done the kind of strategy for this around 2 years ago. And we're now in more of an implementation phase of trying to fundraise and get the system up and running so that we can begin practicing it.
We got to put that fundraiser link on the bottom of this interview then. I mean, that's amazing. And you're right. We don't have that in place in the global north.
Yeah.
And the fact that you're doing it there, I mean, that talks about what you've been doing for 21 years and the research that you've done to come to that place, and to be able to trace that would be remarkable. And is the only kind of, you know, they refer to this as the hammer and the dance. Listen, when the hammer comes back up and we all have to dance around until we have an actual vaccine, we have no capabilities of doing any kind of organized tracing of anything, let alone, you know, you're talking about 26 diseases. We don't have it to do it with one.
Right.
And it's really sad. It's not sad. It's remarkable, because I think when government fails, people step up. And I think you're a perfect example of that. I think the privatization of technology, you know, obviously Apple and Google are doing their part. You would obviously have to use some sort of technological tracing for this. Do you do it through cell phones?
Exactly. No. So we're actually going to be using Sentinel sites in different parts of Madagascar. We have administrative level data, which is all geolocated, but then we'll also have geolocated households with kind of private identifiable information. That's all being connected to all of the geolocated remote sense data.
Well, if anyone can pull it off, it's going to be you. When you did that study, how many kids was it? 73 kids?
Yeah, it's going from 73 kids. Our most recent study was 6,000, and then this one will hopefully be more in the hundreds of thousands.
And you were having it, as far as nutrition goes, you were like down to the gram of every single thing that people ate. So you're clipping fingernails and testing for different types of parasites and fecal matter. I was just like, my God, I want to hire this guy for everything.
This was, I was the ultimate fixer on site there to get all of that done.
It's unbelievable. But that's what I mean, is that from a national standpoint, we're not capable of that, or we don't have the organization to do it. And so we put it into the hands of people like you, which, you know, I think that brings me back to one of my favorite quotes, and maybe the right way to close in on this conversation, which is that Mr. Rogers said it, and he would be watching the news and he would see something scary. And his mom always said to him, when you see those, look for the people that are helping. No matter how scary it gets, you're always going to see somebody who's helping. And I think that's a perfect example of what you're doing in Madagascar. And we appreciate it it's a necessity. And I'm overwhelmed by just your dedication to getting it right. It's really inspiring.
Thank you, Eric. I really appreciate that. So sorry for deviating the conversation, but I will answer your question about the food system approaches.
Yes, please do.
This is something where I am, the field of kind of sustainable food systems is this enormous thing. And I am kind of an expert in one tiny piece of it. And so I'll kind of gloss over the fact that this is a much larger field and then talk about some of the specifics that I know about.
I love specifics. Hit me.
Okay. So in general, the path to sustainable food systems will require the development of a lot of kind of agrobiodiversity systems. We can no longer kind of heavily rely on these massively monocultured crops that are being produced in certain areas and then displacing all of the environmental costs into those localized areas and then relying on trade and markets to get those food products to the places that need them.
Monsanto.
So this is kind of very evident with everything that's happening right now, where all of the trade systems are failing. climate change is going to deeply affect the way that trade systems will operate, the way that countries will close their borders, the ways that we will understand the trade system, I think, will dramatically change in the coming decades. And so increasingly developing systems of what's called food sovereignty, where localized areas or nations can develop systems of sustainable food that are reliant on their own localized resources, becomes increasingly important. And developing those systems that not only don't exceed their environmental limits, but also meet human nutritional needs, is that kind of tricky space of optimization that requires a lot of active research. And so there's different ways that you can get there. There's kind of technological ways that you can get there. Before we started this, we were talking about kind of lab created meat.
Right.
So there's technological ways that you can get there. And then there's more kind of grassroots and holistic ways to get there. And that tends to be more of what I focus my research on. And so a lot of parallels that I began noticing with my research in Madagascar that looked at terrestrial wildlife declines and human nutrition was I began reading all of these kind of research reports or newspaper articles that talked about everything that was happening with global fisheries, and that fisheries were declining around the world, coral bleaching was happening everywhere, fishing industries were sinking billions of dollars. You know, all of these things were really inspiring to me to develop more of what my current body of research is focused on, which is to look at how marine and coastal ecosystems could potentially deliver sustainable fisheries to local populations with the aim of meeting their nutritional needs. And again, this kind of brings this distinction between the global north and the global south, because much of the way that we get our fisheries tends to be from a globalized market food system. What happens in the developing world is it's typically far more reliant on what's produced at national levels. And so for most of the kind of what are called food insecure, kind of lesser developed countries, many of them are relying on their own production or on some of the kind of cheaply produced Asian forms of aquaculture to come in to support food needs. And if you also look at the statistics, I think that the latest estimates, I'm probably going to get this number wrong, show that roughly 60% of global fisheries are either overexploited or fully collapsed.
Wow.
So when you think about that, it's pretty wild to imagine that we have done such a job of kind of decimating the oceans that they're no longer able to provide food for people. And I think that it's something like, there was a recent research article that I was a part of. It was led by Doug McCauley at Santa Barbara. And it showed that if you look at all of the global industrial fishing effort that's happening, 93% of it is coming from industrialized nations. And yet I think that more than 70% of it was happening in the waters of the global south. Yikes. And so again, shows this kind of mismatch and this kind of issues of environmental justice of who is extracting resources, who's bearing the burden of those environmental costs, and who's gaining the resources and benefiting from them. Yeah. And then when you look at it from a demand side of who actually needs it from a nutritional standpoint, right, there's kind of this drain of nutrients that's going from global south to global north, when it should be the exact opposite from a needs-based perspective. Yeah. And so the reorientation of both fisheries management and aquaculture in a nutrition sensitive way, I think would do an enormous service to global human nutrition. And so there was a paper that I published in 2016 that looked at what will happen to fisheries over time with sea temperature rise. And so we know that different species have different types of climate envelopes, so they're happy in kind of certain types of waters, and that by 2050, fisheries are going to move poleward as the temperature gets really hot around the equator. And so their envelope kind of moves to increasing latitudes. And what that shows is that there would be a roughly 50% catch decline all along this kind of equatorial area of the world, which coincidentally, of course, are the areas that are most food insecure.
Right.
And so not only are those areas food insecure, but they lack kind of marine governance and management approaches. They lack adaptive capacity when it comes to climate change. They are food insecure, malnourished, et cetera. And so it really presents this kind of looming food crisis of what will happen given these anticipated changes from climate change. And so really going into these more grassroots approaches of how can we actually better manage the local fisheries and the ones that will remain? How can we actually act to counteract some of these issues of coral bleaching, mangrove degradation, all of these things that are mainstays of local people's livelihoods? I think it's just kind of that common story that environmental degradation is definitely going to be borne on the backs of poor people around the world, and it's an injustice. And so whatever we can do to help to manage these natural resources in a more sustainable way, the benefits will be multiple fold.
Well, let's look at this then from a viewer standpoint. I'm a pescatarian. So how do I live that truth? You know, knowing that we're part of the industrial nation that is taking all the 93% of us, what was the number? It was horrifying. How do I live a life of sustainability for fisheries on a regular basis?
Yeah, I think that's a great question, and one that I wish I could answer perfectly. At the end of the day, all foods have some sort of environmental cost, some more than others. And then it also matters what you care about. So you as a human, Eric, what do you care about? Do you care about organic? Do you care about fair trade?
Yep.
Do you care about child slavery being involved?
Yep.
Do you care about local? There's so many different axes by which food has some amount of information, and to optimize across all of them will be impossible. And so you need to have these trade-offs and to understand the kind of implicit moral values that you're putting into your dietary decisions.
Right.
And so I think that there are some clearer answers. For instance, for me, avoiding shellfish like shrimp from Southeast Asia.
Yep.
It's kind of an easy one. You're minimizing child slavery, minimizing environmental destruction. You're protecting your own health because of all of the antibiotics that are flooding into that. It's a pretty safe decision to say, okay, I'm going to take a pass on that one.
Great.
But many of these are just not as clear decisions. So one of the projects that I'm working on right now is actually a joint project with the Nature Conservancy, and a postdoc of mine is leading it, who is actually based in Israel. And so what we're doing is actually looking at the structure of aquaculture programs in different countries around the world to see what types of fish they're producing, how they're producing them. And then to say, okay, well, let's start here at what the food system is producing from an overall nutrient flow standpoint. And we look at the population, what types of nutrients they need. And then we can actually optimize a space to say, okay, well, we should be producing these types of fish under these types of production systems to maximize the types of nutrients that this population specifically needs, while at the same time minimizing the environmental cost. We know across the board that aquaculture on average is much better than chicken, beef, lamb, pork production in terms of greenhouse gas impact.
Right.
But we also know that there's one type of beef, essentially. There's one type of pork. There's one type of chicken for all intents and purposes. And there are hundreds, if not thousands, of different types of fish that are being consumed. And so we need to really do an active body of research in terms of figuring out which ones are going to be the best ones to produce. And so that's kind of what a lot of my team is working on right now, is that solution space of looking at how we can create more sustainable aquaculture systems, and also kind of more grassroots fisheries management principles, in addition to marine protected areas, which we know will rehabilitate fish stocks and allow kind of a more sustainable flow of seafood.
Wow. That's a great answer. You're gonna have to keep us posted on that, because that seems like a pretty good map to navigate all those complexities when you care about biodiversity and organic. And the only thing we don't do is local. We get our mussels from farmed off of the coast of Spain, from Patagonia, sustainable farming. And we get our salmon, pink salmon, also from Patagonia. But I mean, that's the thing, is that nothing is black and white. And when you get into,
and we also have to understand that you are an outlier, and that the American population
doesn't have the opportunity
informed about the trade-offs that are embedded within their food decisions.
Right.
And even if they were, there are so many places of people that are living in kind of food deserts that don't have the options to choose one thing over the other.
Right.
And so it really does rely on us, I think, from a more top-down societal approach to create ready-to-make, convenient food options that are sustainable.
Right. So what is our version of sustainable?
I don't think we can rely, as much as I love human grassroots movements of people that care about the environment, and I'm part of that and I love it, I don't think we can rely on that.
Right. So we got to create our version of sustainable, cheap Asian agriculture.
Yeah.
Because they're doing right now is what? Shrimp, and they do tilapia, and they do...
Actually, lots of stuff that they're doing is quite sustainable and well done. So if you go across the board and look at kind of Bangladeshi aquaculture systems, they're doing an amazing job of having this really be nutrition sensitive and climate smart and gender mainstreamed and whatever other key terms that you want to do.
Yeah.
But they're doing a great job of it.
So we should just mimic that.
Learning best case scenarios and kind of passing that on and having that be transmitted across borders sounds easy, but it's not all the time. And so I think that we really do need to look at these kind of success stories and see where we can apply them.
Yeah. And you're doing that in partnership with the Nature Conservatory?
Yeah, so the Nature Conservancy is working with us on the aquaculture work, and then I'm working jointly with Conservation International and Duke University on the marine protected areas work, where we're actually trying to quantify the human nutritional benefits of marine protected areas. I don't know if you're familiar with the kind of idea of 30 by 30, where many organizations and governments have come together to say that they want to protect 30% of the oceans by 2030.
Oh, wow.
And yet where that will be is yet to be determined. And much of it is being driven by an agenda centered on biodiversity conservation. And what our team is trying to do is to add a dimension of human nutrition and human needs to that, because we can't think of these systems in isolation.
Right.
And so where would we put these marine protected areas to maximize the benefits to populations most in need?
I love it, man. You're doing it.
Yeah.
You're doing it. Well, this was supposed to be a 30-minute conversation, and we're at minute 56. Sky, is there anything you want to add to this? Anything that I'm missing? You want to add some climate change optimism to this conversation?
Yeah, Chris, tell us what you're optimistic about.
That sounded sarcastic. I thought my whole presentation was optimistic today. No? I mean, I am really optimistic about the work that I'm doing with Ocean. So many people have critiqued my work in terrestrial systems to say, why are you promoting bushmeat consumption? It has such devastating impacts. And my view is that I've never promoted it. I've merely shown that there are much more broad kind of rippling impacts to broader communities that we need to take into consideration when trying to reduce those impacts. But I do see the kind of fisheries and ocean work that I do as a true win-win, where you can improve the management that you're practicing. You can improve the types of aquaculture that you're deciding to produce. You can proliferate marine protected areas, and all of those things will increase biodiversity, ecosystem function, et cetera, while at the same time providing these very tangible human benefits.
Well, and that's great, because we now, again, as I said before, it's no longer a theoretical conversation. There are real consequences. This is a time of crisis for the species. And those are when growth happens, most easily, because we can change perspective, and that's what you're doing. Indiana Jones.